I haven't shot a video of a female hairline design for maybe a few years, to be honest with you. I don't even know if I can show the full resolution of this, but I think it's an interesting one. This is a 66-year-old lady that has had chronic hair loss, and we decided before that we would focus on the right side, which is where she parts her hair. So with women, the first lesson is not to stick hairs everywhere because you're not going to get good density. You're not going to get a reasonable result. You want to target it. And so this is a very large target. It's on the right side of the scalp going into the central forelock, but the way she combs her hair is to cover the left side. Now we can always go back a second session and do grafts there. But the reason why I think this is an interesting video, and I don't know if it's really visible, you may have to blow this up on a larger screen, is the angles go back this way. You know, most hairlines go forward, but hers goes back this way, okay? And as you come this way, they sweep down, and then they actually go exactly straight that direction, and then go down this way, and then go this way. So they sweep like this angle, and then they go down that side. So on the left, if I had built her left, these angles actually go forward and down, and these go backwards and down this way. The reason this is so important is that if she had more hairs here, if I had gone against her natural grain, she would have a hard time combing it. But the second reason is you want to follow that anyways. It tells you which natural way her hairs are going. The third reason is if you transect a lot of her native hairs, you're going to cause a lot more shedding and have problems. So there's so many reasons to do this, and it's important that most men have their hair going straight forward and this one going down. But this whirl is very important to match. It's also important, and sometimes with judgment for staff, is if it's way too complicated and there's not a lot of hairs there, sometimes you just make your own pattern to fit it, because otherwise the staff will have a hard time placing into it. This is a pretty easy pattern to fit because there's no abrupt angles. That's a final lesson here, is that when you're designing recipient sites, you don't make an angle that goes from here to there. Not only is it hard to place into, not is it hard to comb into, but actually it doesn't mimic nature. Nature is such that there is a gradual change. And that's why you have to look very, very carefully when you're making a design. And this is a really complicated one for a female hairline. And I didn't actually notice it during the consultation, but during surgery, I always sit and look for a while and look at it, and my eyes really focus in on the design. And this is just showing you the whirl. You probably have to blow this up on a huge 60-inch high definition screen to even see these recipient sites.